Welcome to Special Education with Hamid Naqvi. Let us practice some more MCQs. This time we are going to practice the MCQs relating to autism spectrum disorder. And the main reason is that some of the young special educators they confuse the characteristics of autism spectrum disorder with intellectual disabilities. So let us start. Which of the following is a primary characteristic of autism spectrum disorder? High social engagement, difficulty with communication and social interaction, intense interest in multiple topics simultaneously, or easily distracted attention span. Answer is B, that is difficulty with communication and social interaction. The reason is that difficulty with communication and social interaction is a core characteristics of autism, often evident through challenges in understanding social cues. Next MCQ is which age group is most commonly screened for early signs of autism spectrum disorder? Adolescent, young adults, toddlers and preschool age children, or adults? The answer is toddlers and preschool aged children. Early screening of ASD typically occurs in toddlers and preschool age children as signs often emerge around this developmental stage. Next is what is one of the most commonly used diagnostic tools for autism spectrum disorder? Rorschach's inkblot test, Autism Diagnostic Observation Schedule, Sanford Binet IQ test, or Beck Depression Inventory? Answer is Autism Diagnostic Observation Schedule. Autism Diagnostic Observation Schedule, which is in short, we call it a DOS, is a standardized tool used to assess social interaction, communication, and behavior associated with autism. Next is which of the following behaviors might be a sign of repetitive behavior associated with ASD? Mimicking other people, constantly touching objects around them, repeating the same phrase or movement multiple times, ignoring other people. Answer is repeating the same phrase or movement multiple times. Repetitive behaviors such as echolalia or repetitive movements are common in ASD and are part of diagnostic criteria. Which therapy approach is widely used to help individuals with ASD develop communication and social skills? Dialectical behavior therapy, applied behavior analysis, psychoanalysis, or exposure therapy? Answer is B, that is applied behavior analysis. Short is ABA. ABA is commonly used behavioral therapy in ASD treatment, focusing on reinforcing positive behaviors and developing communication skills. What is the purpose of social stories in working with individuals with ASD? To promote memory recall, to develop academic skills, to improve social understanding and behavior, and to practice language skills only. Answer is to improve social understanding and behavior. Social stories help individuals with ASD understand and prepare for social situations, often improving social behavior and comprehension. Next is which of the following is not a common sensory sensitivity in individuals with autism spectrum disorder? Aversion to loud noises, strong reaction to bright lights, seeking a tactile stimulation, or reduced reaction to social praise. Answer is the last one, that is reduced reaction to social praise. Sensory sensitivity in ASD can involve heightened responses to stimuli like sounds, lights, or textures, but social praise is not typically a sensory sensitivity. Next MCQ is which genetic condition is often associated with a higher risk of ASD? Turner syndrome, Fragile X syndrome, Marfan syndrome, or Rett syndrome? The answer is B, that is Fragile X syndrome. Fragile X syndrome is a genetic disorder that increases the risk of ASD, especially in males, and is often accompanied by intellectual disability. Which aspect of communication is commonly impaired in individuals with ASD? Understanding complex instructions, following simple commands, recognizing idiomatic expression and sarcasm, responding to their own name. Answer is recognizing idiomatic expressions and sarcasm. The reason is many individuals with autism spectrum disorder struggle with non-literal language such as idioms and sarcasm due to challenges in interpreting social nuances. Which term refers to the intense focus on a particular interest or subject often observed in individuals with ASD? Intellectual preoccupation, restricted interest, obsessive behavior, cognitive fixation. The answer is restrictive interest. And the reason is restrictive or intense interests are common in ASD, where individuals may exhibit focused attention on a specific topic or object. Which is common sign of ASD related to eye contact? Prolonged eye contact, avoidance eye contact, excessive blinking when making eye contact, fixed staring without blinking. The answer is B, that is avoidance of eye contact. Avoidance of eye contact is often noted in individuals with ASD, contributing to social interaction difficulties. Which of the following is a widely recognized tool of screening ASD in young children? Autism Spectrum Screening Questionnaire, Modified Checklist for Autism in Toddlers, that is MCHAT, Wessler Intelligence Scale for Children, or Beck Anxiety Inventory. Correct is B, that is Modified Checklist for Autism in Toddlers, in short MCHAT. The MCHAT is a screening tool designed to identify early signs of ASD in toddlers to facilitate early intervention. Next is which behavior therapy focuses on breaking down tasks into smaller steps to teach specific skills to individuals with ASD? Functional behavior analysis, cognitive therapy, task analysis, or group therapy. Tests that correct answer is task analysis. The reason is the task analysis is used to teach specific skills by breaking them down into small, manageable steps, often beneficial for individuals with ASD. Next MCQ is which sensory reaction is commonly observed in individuals with autism spectrum disorder, or reaction to temperature changes, no reaction to sounds, hypersensitivity to touch and sound, indifference to bright colors. Correct is C, that is hypersensitivity to touch and sound. Many individuals with autism spectrum disorder have hypersensitivities, particularly to touch and sound, which may result in discomfort. What is one goal of occupational therapy for individuals with ASD? To improve excessive language skills, to increase academic skills, to develop fine and gross motor skills, and to reduce cognitive skills. The correct is C, that is to develop fine and gross motor skills. Occupational therapy helps individuals with ASD develop motor skills needed for daily activities as well as sensory integration and coping skills. Next MCQ is which of the following social behaviors may be challenging for individuals with ASD? Recognizing danger, initiating and maintaining conversation, following physical activities, retaining factual information. Correct answer is initiating and maintaining conversation. Social communication is difficult for individuals with ASD, including initiating, sustaining, and reciprocating conversation. Next MCQ is what is echolalia, a common communication trait in ASD? Repeating others' speech, avoiding conversation, speaking in a monotone voice, using complex vocabulary. Answer is repeating others' speech. Echolalia involves repeating words or phrases heard from others and is communication characteristics sometimes seen in individuals with autism spectrum disorder. What is the primary purpose of early intervention program for children with ASD? To prepare them for high school, to reduce behavioral symptoms and improve developmental outcomes, to encourage independent living immediately, to integrate them into competitive sports. Answer is to reduce behavioral symptoms and improve developmental outcomes. Early intervention programs aim to address symptoms early, enhancing language and social skills and developmental progress. Next is which of the following best describes giant attention, which is often challenging for individuals with ASD. Responding when the name is called, focusing on a single type for hours, sharing focus with another person on an object or event, imitating adult actions. Correct answer is C, that is sharing focus with another person on an object or an event. Giant attention refers to the shared focus on an object or activity, a skill that is often difficult for individuals with ASD. Which intervention method for ASD involves teaching appropriate social behaviors through modeling and direct instruction? Social skills training, music therapy, psychoanalysis, or functional analysis? Answer is social skills training. Social skills training uses modeling, feedback, and practice to teach appropriate skills behavior which can improve social interactions in individuals with ASD. Next MCQ is, what is the role of speech therapy in managing autism spectrum disorder? Teaching only reading and writing, improving language and communication abilities, solely improving social skills, or enhancing physical coordination? Answer is B, that is improving language and communication abilities. Speech therapy, we know, focuses on developing language, communication, and social skills, helping individuals with autism express themselves more effectively. Which dietary approach is sometimes explored by parents of children with ASD, though its effectiveness is not scientifically proven? Ketogenic diet, gluten-free and casein-free diet, high protein diet, or Mediterranean diet? Answer is B, that is gluten-free and casein-free diet. Some parents try a gluten-free or casein-free diet for children with ASD, though there is a limited scientific evidence supporting its effectiveness for autism symptoms. Next question is, which is common focus in behavioral interventions for children with ASD? Reducing math skills, increasing physical stamina, developing coping and adaptive skills, reducing language comprehension. Correct answer is C, that is developing coping and adaptive skills. And the explanation is that behavioral interventions often focus on teaching coping and adaptive skills to help individuals with autism spectrum disorder manage daily challenges more effectively. Which social behavior may be difficult for individuals with ASD to understand and perform? Performing physical activities, sharing or taking turns, playing alone, understanding mathematical concepts. Answer is sharing or taking turns. The reason is many individuals with autism find it challenging to understand the concept of sharing and taking turns, as these involve complex social interactions. Which of the following is an example of stimming in ASD? Reading silently, humming or rocking repeatedly, drawing complex pictures, playing a board game with others. Answer is B, that is humming or rocking repetitively. Stimming or self-stimulatory behavior includes repetitive actions like rocking or humming, often used by individuals with ASD to manage sensory input or self-soothing. With this, we come to the end of this video. See you in the next video. Till then, best of luck.